Well, hello everyone, and happy National Native American Heritage Month. Really excited today to continue our important conversations around equity and dementia. And as you all know, we have some really important information about Alzheimer's disease and other related dementias, with more than 6 million Americans aged 65 years and older living with Alzheimer's. That number is expected to more than double. COVID is hitting people harder with Alzheimer's, 16% increase in deaths, and then disease-related costs continue to rise. But we don't know as much about Alzheimer's and other dementia in the American Indian, Alaska Native population. So we're really excited today to have Dr. Neil Henderson, who is an enrolled member in the Choctaw Nation of Oklahoma and recently retired from BioBehavioral Health at the Minnesota Medical School, and longtime NIH grantee and strong collaborator and member of the planning committee of the Alzheimer's Association Health Disparities scientific meeting just this past summer. So welcome, Dr. Henderson. Thanks for joining us today. Glad to do that, Dr. Hill. Appreciate it. Well, so what do we know about Alzheimer's and other dementia in the American Indian and Alaska Native populations and communities?
To focus on the word, what we know, means that I have to say we know that we don't know a lot. The bits that we have, I think, are have to be really seen as preliminary and hypothetical. So we have a set of hypotheses, which is great for directions to follow in terms of research. But what we have shreds of evidence for, and I'll begin with biogenetics and move into more cultural factors, is that it does seem that there is some genetic variation across tribal groups, and that means regionally, geographically across North America. And probably this is mirrored in Middle and South America too, with indigenous people there. Just focusing on ApoE4 and frequency of that it seems to be widely variable from group to group. And in work that I did with Oklahoma Choctaw and a geneticist named John Hardy and others, as well as another retiree, Roger Rosenberg, working with Oklahoma Cherokee people, we did find that when E4 was present in a person that had a very high genetic load of indigenous genes, that it did not seem to have the potency to convert to symptomatic Alzheimer's as it did in an analog white person. So that would be something extremely important to pursue, I think. We also, switching more into kind of an epidemiologic perspective, is that when we factor in a significant comorbidity for indigenous people in North America, it's diabetes, type 2 diabetes. When we add that into a person's medical profile, then the frequency of dementia symptoms goes way up, as we might expect. And so there's cardiovascular issues, endocrine issues that all mix together to cause, in one survey, the American Indian Alaska Native group to have the highest frequency of dementia. We're not getting specific into FTDs or just Alzheimer's, those kinds of things, just dementia for the moment. And so that is something that allows us to separate out some combination factors, particularly that are highly relevant to American Indian Alaska Native people because of the prevalence of type 2 diabetes being almost double that in the white population. And then as we move along and consider onset of symptoms with dementias, has always been the later life and more age, more chances of showing up symptoms. Going back as recently as the 70s, nationally, indigenous people in this country died earlier than the majority population, to the extent that we don't know how much dementia might have developed had those people lived an equivalent amount of time as the white population. But so people were dying off too early, in a sense, to be able to pick up symptoms and be part of our numbers. And so today, indigenous people still live at ranges in demographics I've seen from 3 years younger at death than the white population to 6 years. And then that varies from tribe to tribe and region to region as well. So there are some places that still have this real severe early mortality in their 50s as a group. So the cultural piece of this, it means that this is a relatively new phenomenon to begin to impact Indian country. Maybe 20 years to 30 years behind demographically and epidemiologically the white population, the majority population. And it makes me think of a time that would have been in the mid to early 1980s. I was giving an in-service training at a tribe to community health representatives. These are people that go out into the communities and do health education and basic monitoring of glucose levels and blood pressures and things like that. And about 10 minutes into my talk about dementia, someone raised their hand and said, well, why are we addressing this? Because Indians don't get Alzheimer's disease. And by the end of my little 45-minute talk, this group of 30 community health representatives had identified 16 people that they regularly worked with as clients in the communities, and that they might be candidates for someone that is developing dementia. Otherwise, they just saw them, they're old people, and so they don't remember so well.
Yeah.
So I had created my own little epidemic of dementia there in that one place. But it is a lesson about the recency for Indian country of how awareness of dementia is not as old and routine as it is in the majority population.
Yeah, interesting, Dr. Henderson. I tell you, and to look at that from the biological, behavioral, sociocultural, levels of analysis certainly demands rigorous health disparities research. And so these are important speculations, but we certainly need, more engagement, more inclusion of American Indian, Alaska Native populations as, research participants. So, what have you learned? What approaches, do you recommend for, engaging American Indian, Alaska Native communities? As you know, we have great staff working in chapters all around the country who are, looking to engage these communities with our important resources and care and support and other great resources that the association has. But what approaches do you recommend in trying our best to engage these underserved populations and communities?
I think, Carl, what has worked well for me and what I have seen that works well elsewhere with this is this approach to connecting with Indian country regarding dementia research, where that has worked, is an interpersonal connection and communication. That means that a person, a researcher, would identify a person in the health programs at a tribal community. And that can be found on their websites, by the way. So it used to be that you'd get tribal newspapers, and now you can go to the websites. And I think it's important that the interaction is one that is very respectful, that does not try to capitalize on, I'm a researcher and I know everything on the planet Earth, and that you have nothing to offer me but giving me some blood or letting me do an assessment, and we'll go away and come back and tell you how we're going to fix you. Just in any of that. it doesn't work. And so it comes under the big heading of community-based participatory research, but the participatory piece means that people need to go there. Don't just have an email only or a phone call only, but as people need to get off their rear ends in their comfortable office and drive a few hours, probably.
That's right.
And then the next step would be to give something to the tribal community. Don't just take information.
That's right.
And that giving can be, just like I described earlier, this in-service training, speaking at a conference, having a place in which a tribal member in the health program or other social services, whatever the terminology might be, come visit at the research location and meet those people and see the place. And those things take time, but that's the good thing about it. It takes time to have a relationship.
That's right. That's right.
And so it's not just a cattle call. You put an ad in the newspaper, local newspaper, for we need subjects for this. Just don't waste your time.
Yeah. We Dr. Henderson, we talk so much at the association about participatory engagement and process of establishing trust and becoming trustworthy, takes some time. And the great thing about our chapters is that we have resources free of charge, about Alzheimer's and other dementia that we like to share with American Indian, Alaska Native communities. So our focus on community-based participatory engagement by developing partnerships at the local and national levels, I think is right in line with this vision for doing more in these communities. So I guess Dr. Henderson, as we begin to wrap up here, can you give us more insights about this engagement or dementia in American Indian and Alaska Native communities with your work with the savvy caregivers for Indian country, or I know that you're working with the International Association for Indigenous Aging, so give us some tips, some things that we can pay very close attention to as we strive to do more with our pursuit of health equity for American Indian and Alaska Native populations.
Sure. And the Savvy Caregiver is a psychoeducational program for the caregiver designed to help them adjust their caregiving techniques and approaches in accordance with the progression of the symptoms that the person has. And Dr. Ken Hepburn, now at Emory University, and his team developed that initially. I got a grant back from the Administration on Aging and the National Indian Council on Aging to indigenize that caregiver program. And so with a panel of people that I assembled, Native and non-Native, experts and lay, we came up with a way of maintaining the evidence-based outcomes of evaluation for the Savvy Caregiver, and added onto it an approach in which we had the challenge of the hugely diverse cultural variation across coast to coast and north to south, and make this usable for with the ability to localize it to a particular culture, to Choctaw, Oklahoma, or to Santa Ana Pueblo in New Mexico, or other places in the Northwest coast, is everywhere. And that technique was to actually conduct a little mini course on culture and health matters and beliefs about dementia, and to not find fault with beliefs about dementia, but to negotiate a way of saying your cherished beliefs are valuable, and that's a way of understanding. And I want to share with you another partial way of understanding, and that we will work together to maybe find some common ground. So the 6 lessons in the Savvy Caregiver project in our Indian country version, before each lesson, there is a set of guidelines to the person who's helping the caregiver learn new ways of doing it. That will make it local to that tribe. And it might be language terms. It might be consideration for the ethics of communication in small communities. It could also be to mobilize matters like the valuing of elders. The elder value in an Indian country is such that caregivers might feel really guilty if they take some time off, or if they express any kind of stress or burden from this. And so we help them to say, caregiving is a way of honoring the elder, and you must also honor yourself. And putting it in those terms then begins to have a more localized fullness of meaning that I can get behind, rather than just memorizing some list of bullets on a page in a guidebook.
Absolutely, absolutely. I think what you've just described is this process of pursuing equity, right? It's not a one size fits all, or every community within the American Indian Alaska Native population, should have a tailored approach for providing these very important resources, and that is
a tailored approach.
Yeah.
And there's intra-tribal cultural variation, cross-tribal, and I think actually the structure and concept of indigenizing the savvy caregiver is a process that can apply to any other population as well. The same strategies of valuing the other rather than devaluing the other, valuing the other. Imagine that.
That's right. Strengths and opportunities and capabilities. I tell you, so important. So well, Dr. Henderson, thanks so much for spending some time with us as a longtime colleague, and I could probably say mentee of yours. We've been working together for a very long time. I certainly salute and congratulate you on your recent retirement, but I'm hoping that we can still call on you from time to time to give us some advice about engaging American Indian Alaska Native population. So Carl Hill here signing off. Thanks so much with Dr. Joseph Neil Henderson, and looking forward to staying in touch in all of our work together moving forward.
That sounds great to me, Carl. I really appreciate it. And your work over at NIH and NIA, and now here, just keep up the great work you're doing.
Thank you, sir. Thank you, sir.